this is ethics problem solving from group 7. So our problem is a 14-year-old female presented to the GP with her father for abdominal pain. The most likely diagnosis was appendicitis, but to account for other diagnoses, such as a ruptured ectopic pregnancy, a pregnancy test was needed to be performed. The GP consented the patient for a urine collection, but didn't ask for consent for the pregnancy test. The parties present was the patient's father, and the GP, and the problem was that no informed consent was obtained for the pregnancy test. The values, principles, or ethical practices that were involved are beneficence, autonomy, and informed consent, and these will be discussed.
There are a few legal parameters which apply to this case. The first is the Code of Rights, and the Code of Rights that are bolded in blue here are the ones that really do apply to this case. That's right 1, right 5, right 6, and right 7. Also, as a minor, you need to think about whether she has full competence and capacity, as this plays a role in your professional decision making. There are some options for action, alternative actions that could be taken. The first is to complete a capacity assessment of the patient with regards to her situation, and the second is to discuss the reasoning behind taking a pregnancy test and take a focused sexual health history with the patient privately.
These are the relevant ethical principles for the 2 actions just discussed. So these actions respect the children's inherent possession of the HTC Code of Rights. They respect that the patient may have capacity to give informed consent. They respect patient confidentiality, and they demonstrate beneficence.
There are some ethical problems with each alternative action. These negative implications include poor rapport between the patient and the doctor, and a potential for missing an ectopic pregnancy, which could cause harm. Some positive implications include respecting the patient's autonomy and having informed consent and better communication and trust between the patient and the doctor. The course of action we chose to be the most ethical was to complete a capacity assessment of the patient with regards to her situation before proceeding to obtain either consent or assent for the pregnancy test. If the patient is deemed to have full capacity, informed consent should be obtained. If the patient is deemed to not have full capacity, then obtain the father's consent and receive patient's assent. Discuss possible diagnoses for abdominal pain, including ectopic pregnancy, and what tests need to be run and why. This respects the children's inherent possession of HTC Code of Rights, respects that patient may have the capacity to give informed consent, and exercise the patient's autonomy, and it demonstrates beneficence as well.
This action is justified because it aligns both with the ethical principles we have discussed, including respect for patient autonomy, beneficence, as well as the patient's right to be fully informed and give informed consent. Some objections to this course of action include the fact that the GP won't have time, considering appendicitis may require urgent diagnosis and the GP consultation time is limited. Secondly, the likelihood of pregnancy in this patient's case is low, and a pregnancy test is simple and fast to complete. Informing the patient creates a possibility that they may decline when a pregnancy test is important to rule out other diagnoses. And finally, it may have worsened rapport with the patient. Some replies to these objections include that the fact that an explanation to the patient will not require more than a few minutes, information can be summarized, and a pregnancy is quick to complete. Informed consent is still an important aspect of patient care, and the patient has rights to such services as justified previously. And finally, the patient and caregiver may appreciate the thoroughness, honesty, and care that the GP is giving. Thank you.